What is going on, everyone? This is your daily dose of mental health with Adam. And in this video, we're going to be cutting right out of the bullshit and going right into this topic. And we're going to be talking about how to de-escalate a patient that is in crisis. Now, before I go any further, please like and subscribe to the channel and leave a comment, whether that's positive or negative. I really could give two shits less. I don't care. But I like the feedback anyway. I like to read the comments because it'll make me chuckle. But that's just how I am. But in all seriousness though, when I went through nursing school about 3 years ago, or no, 4 or 5 years ago, fuck it, at this point I don't even know when the fuck I went through it. I think I graduated in like 2018 or some shit, whatever. You take a mental health course and you have mental health clinicals, which you should, and there's some nursing schools that do not do that, which shame on those motherfuckers. Because if you're just reading the book, you don't get anything out of it. My point to this is that reading your textbooks in nursing school, and in particular mental health, you have to do to pass the test, right? But in all honesty, half the techniques and things they teach you in those textbooks are just straight bullshit, and the people writing those books know it. They know that it sounds great on paper, but they've never actually practiced them in the field, even though it says by their name, you know, they have an MSN or their DNP or whatever. But a lot of them don't even have much experience, or have been or biggest thing is had experience but are out of practice. They've been out of practice for 20 plus years. That's the thing you'll realize is a lot of people who are promoting and writing these books do have experience, but they haven't practiced in 10, 20 years plus. So, what is the whole point of this video then? Well, as I said, how do you truthfully de-escalate a patient? And how do you know if you're in an unsafe situation? So, let's start with this. When a patient walks in the door in a psych hospital, let's just say they walk in and they're in a crisis, or better yet, let's go into this. They're in psychosis, okay? Let's just throw an example out. A patient's been off their meds for a couple months. They've been off their meds for a couple months. That's what the person who's bringing in the patient tells us, but they don't give us any other health history. So we don't know, in the system, it doesn't tell us if they've ever had a psych history, if they've been in a psych hospital. We don't have anything. So they walk in, they go through the intake process. They send them back to the unit pretty quickly because they can't get much out of it, and the patient is starting to escalate, wanting to get out of there, banging their head out, essentially out of their mind. And that's a word you wouldn't use in the textbook, but let's just put it as it is. And I'm not trying to be offensive toward anyone. I am a psych RN, hope to be a psychiatric nurse practitioner one day, but I call it as I see it. Now, first things first, let's go back to the intake process. The first thing that should be done is there should be a keyword intake nurse. Yes, an intake nurse should be assessing the patient and doing the initial nursing assessment before they even come to the floor. Before they come to the floor, meaning whatever floor, if they're on the high acuity floor, whatever floor they're on, where they're going to be exposed to other patients, they need to have an initial nursing assessment. And in most hospitals, it is done in the intake department. Let's say the patient's violent. What do you do next? If you're the intake nurse, hopefully you have some sort of way of calling a code if you need it, or you have a security team there or safety coordinators there. But the number one thing you need to realize is that when they're going through that intake process, you need to make sure that they have been searched. You need to make sure of that. I know they use those wands today, which are good, but a lot of things, people can just slide right through the door. They can put stuff up their anuses, up their buttholes, for another word for it, put stuff up their pussies, their coochies. I've heard all sorts of words for it depending on where I work, either the ghetto, so if I work in suburbia, worked in both places, coochies, ghetto, suburbia, just some pussy, okay? But let's be real honest, let's get back on track. So, in the intake department, even if they're aggressive, if you need to call literally the police to get in there to do your intake assessment, that's what's got to be done, because you need to make sure you have an accurate assessment done before you send them to the floor. They need to have a skin assessment done to make sure that there's no pressure ulcers, open wounds, because thing is if you can catch that there, you can automatically send them to the ER to get proper treatment. Because remember, in a lot of psych hospitals, think about what you're dealing with as an RN. You're dealing with a lot of suicidal patients or psychotic patients in psychosis is what I like to use, that you couldn't start an IV on. That's a danger or a threat to them. In an ER you can. And they have, in an ERs, 99% of the time, they use wrist restraints to where they can't fight it. In a lot of psych hospitals, unfortunately today, they've got, depending on the state, they've gotten away from wrist restraints. What they've been using, they use physical holds, which can be hour-long holds, which is ridiculous. So if you work for a hospital that has to use physical holds in the intake department, you need to call the police. That's the reality of it. Not send them directly to the floor. Because I'll tell you, if you send a psychotic patient like that to the floor and they have, first off, not had their skin assessment done, they have not been checked, meaning maybe they've been kind of wanded, but you don't know what they have on them. They come to the floor with their attire on, whatever they came in wearing. A lot of times the nurses or the staff can't do their skin assessment for at least 45 minutes to an hour because they're dealing with discharges or admissions that are in front of them. So let's say you have a psychotic patient that's brought back to the unit and you can't be with them at that time. What if they have a shank on them? What if they have drugs on them? I mean, you just kind of have to look at it from that perspective, that situation. And I'm not trying to, once again, this isn't a video in regards to saying how I believe the processes should be in hospitals, in psych hospitals. This is how they need to be in all psych hospitals across the United States. This is the number one way you keep staff retention. People don't quit, and most of all, you provide a safe environment for your staff. They feel comfortable, and also so that the other patients around feel comfortable. The worst thing I've seen in my years working in psych, and it honestly, and I'm not gonna lie, traumatizes me to an extent, I'll just be real honest, is when a patient, let's just say there's a patient that we're short-staffed and we can't get the situation under control, and you see the patients just looking at us wanting us to do something more, but we can't, or we'll get fired. And those patients are going through trauma or whatnot, and that's just going to make their trauma even worse and cause even more, PTSD and stuff like that, or even throw them into psychosis by what they're seeing. So, back to it real quick. Big thing. So in intake, another thing before you bring a patient to the unit, they should always, and this is my own opinion and how most psych hospitals run it, they should always be stripped of their clothes. And you might go, whoa, that sounds weird. No, this is a great process, and a process that really does reduce the rates of people getting hurt or staff getting hurt. You need to strip them. While you're doing that, obviously you tell them you're doing this for their own safety. You put them in scrubs. You check them as you're putting them on, and obviously, me being a male RN, if I'm doing this and it's a female, I want a female there to watch as well and observe. Or if there isn't a female, I at least want a second staff member there watching, just so they're there, because there are situations where, patients, if you're a male working in nursing, where if you're the only one providing care and you're on, let's say you're on camera with that patient, then you go off camera and you don't have any backup, patients can say all sorts of things, which can can essentially take your license away. So putting them in scrubs, and then from there, you've done the skin assessment, the nurse has done the skin assessment, and then you take them to the unit. And obviously, this is always, shoes, laces, are taken off. There are no exceptions. No exceptions. When they go to the floor, they have nothing but socks on. Because remember, and we're not trying to treat this like a prison. That's not the objective here. But you just don't know what kind of patient you're dealing with yet and what's really going on. And you don't know if they're violent or aggressive. Or even if they don't have a history of being violent and aggressive, but they're suicidal, they have a history of suicidal ideation or essay, which is they've had suicide attempts, you definitely want to get those off. And even if they're not suicidal at the time, picture someone goes to the unit and one of the patients comes up to him and says, "Oh, I really like your shoes," and whatnot. And the patient's like, "Oh, thank you, blah, blah, blah. Can I try them on?" They take the shoe, they rip that shoelace out, they go right around their neck, and they try to kill themselves. So shoes and shoelaces, that's not even a question. They should never make it to the unit that way. And if that does happen, I'm not trying to once again get, out of this video, it's just straight my opinion. It's my opinion is what needs to happen across the United States, because it happens in a lot of places. If a patient comes to the unit where they're wearing shoes and shoelaces, a nurse that sees it, even if they're not going to be doing the admission on the patient, if they're on the floor and they have the shoes and shoelaces on, a second the nurse sees that on the floor, they need to call their manager or their house supervisor and report it immediately. Don't even go to an incident report. I hate how today the first thing you do is if there's a problem, staff or management will go, "Oh, just write an incident report about it." Okay. Half the time there's no act on it. No, call your house supervisor. If they're not there, call somebody above you and let them know. And more importantly, you let that intake department know that they're not doing their job. Because that is how people get hurt. Because let me run a scenario by you. What happens if you let it slip? You're a nurse on the unit. You see a patient has shoes and shoelaces on and they're full attire on, and they're assigned a room and they're like, "Oh, can I go lay down in that room right now?" And you're like, "Sure," because you're busy. Rounds are done every 15 minutes by PCAs. That's more than enough time to kill yourself. Let's say they do the first round, you're in there and the patient's actively trying to hang themselves, which can be done. Unfortunately, I've seen that as well at a hospital. And it is horrifying. I'll just be real honest with you, it's horrifying. And that's why I bring this video to you, because psych is a field where you really have to be on your game 100% of the time. And it only can be successful if every department from top to bottom, from an ER sending a patient to the psych facility, from the intake department in the psych facility doing their job, to sending the patient to the floor they'll be on, if everyone does their job correctly, that is what leads to success rates in helping the patient and the patients on the floor not having to see traumatizing things. Okay? So, let's say you're doing that 15-minute round and you walk in and the patient is trying to essentially kill themselves with shoelaces. You know whose fault that would be? It would be the people on the floor, and who would take the blame, who would actually get the most in trouble for it would be the RNs on the unit. And you might say, why would the intake department not be? Once again, once a patient is dropped off on the floor to you, it is your responsibility. So it would be your license on the line. Just remember that. I know this is an out of the blue video that I'm doing, but it has to do with psych hospitals. But I hope you get something out of this. Just to really understand that there should always be in every hospital processes in place, and this is why you should always read your hospital protocols in psych hospitals, in hospitals in general, but specifically psych protocols, because if you start noticing these things like shoes and shoelaces, patients are wearing them onto the unit, if you read your protocols, it should be in there that in the intake department, whether there's a nurse in intake or if it's not a nurse or if it's just a clinical assessor, their job is to remove those. And I'm not saying to be a dick to them, but you need to tell them. Don't go, "Oh, could you please take them off next time?" You got to be assertive with them and say, "Hey, this needs to be done," because at the end of the day, it's my license. Right when you send a patient to the unit, I can't get with them a lot of times because we're already short-staffed. And just in general, even if I can, if a patient's violent and aggressive, if they don't let me take the shoes off and they're on the unit, other patients could see this and it could just cause a whole escalation of events. Because if they won't take off their shoes and shoelaces in intake, or give you, let's say they have a weapon on them in intake, then guess what? You call the police will get it off of them and escort them. Or let's say they have a pressure ulcer or something on them, you would send them to the ER to get treatment. And also, if nothing is found, they have their shoes and shoelaces been taken off. I'm not going to go through the whole have scrubs on, but let's say the shoes and shoelaces are off, they come to the unit. You can't see them right away, but let's say you at your hospital, you've got to do the skin assessment on the unit rather than in the intake department. Let's say you start going through it and you see they have a shank on them or something, a dangerous weapon, and they're not going to give it back. Don't even try to fight them for it. Call 911. But hopefully in your hospital that you work in, that won't happen, because if every department does their job, by the time they come to the floor, a psych patient, a lot of these problems can be eliminated. There will always be problems in regards to patients escalating, wanting to leave AMA, wanting this, wanting that, but the way we can provide the best and most proper treatment and care we can as RNs and PCAs, because PCAs do a lot of the work. I was a PCA at one time, or a nurse tech, and I'll tell you this, they are the shit. They are. They do their job. They have a hard job, because they also a lot of times have to play security role, and they don't get paid for it. But if we can all follow our roles, and by the time a patient comes to the floor, we already have shoelaces, weapons, everything taken off of them, a skin assessment's been done, then we eliminate 80% of the problems that can arise. I know this is kind of a random video, but I just wanted to get this out there to the public. This is another video in the playlist that I'm doing, is what it's like to work in a psych hospital. The next video, it was going to be this one, but the next video will be covering, as stated, we will be going over what it's like from a nursing perspective to work in an inpatient psych facility, but more importantly, what it's like to work on a high acuity unit will be the next video. So what is it like from a nursing perspective and a PCA perspective, because I was a PCA, what it's like for us, what we see daily. But once again, this video isn't intended for any like negative stereotypes or anything. This is just a video where if you see this, it's improvements we can make. If a nurse sees this, for example, and things have been happening, you know what I tell you about being blunt to different departments to make sure we have the highest success rates of patient care and positive outcomes, this is what this video is intended for. It's intended for nurses to make sure the protocols are being followed out from the top to the bottom. That's the whole point of this. Because at the end of the day, remember this, it is your license that is on the line. It is your license that you have to protect. I love you all. One more thing, we all make mistakes, that will happen, but this can greatly reduce and eliminate the chances of something seriously happening to your job career or your license. I love you all. Please like and subscribe to the channel. This is your daily dose of mental health. Hope you like it. I'm gonna be real honest, I'm straightforward and I don't bullshit you anymore. And I never have bullshitted, but I like to fuck around sometimes, but there's going to be some more. I know a lot of the videos have been kind of serious. I'm going to just show you some day-to-day stuff, what I do as well, and what I do and how I fuck around and whatnot outside of work. But I love you all. Have a great week. Have a great week. And also, take those shoes and shoelaces off. And don't pass out with your shoes on. Love you all.